I'm president of our, it's an international association, it's a society for tennis and medicine science. In a very similar way, we take people from all across the world who have a shared passion and interest in the health of tennis athletes and caring for them when they're injured, but also helping promote the sport. And I sense the exact same passion here. In fact, to be honest, we actually kind of look at how far this association with, dance medicine has done, and look to try to do that the same way in tennis. We feel we're a little behind where dance medicine is. We would like to catch up to the same type of traction you're garnering here. For this issue with regards to overuse injury, we first started evaluating it with tennis players, and particularly with the junior tennis player, which is a bit of a vulnerable population. We started seeing some significant trends with this issue with training and how much training, and also specializing in a single sport, and then the development of overuse injuries, and then even some serious overuse injuries. And so we started paying attention to this more, and we looked at all sports, and we had about 1,200 athletes, and that included dancers actually, and we wanted to count them as an athlete in our study, and it really helped emphasize some of these findings across sports, which suggested again these training volume risks that could potentially happen. We had a simple rule, for example, that if a young athlete participated more hours per week than their age, they were more likely to have overuse injury, but also serious overuse injury where they may be out for 1 month or longer. And that number may be different for dance. And so maybe an age versus hours rule doesn't work, but there must be some age-appropriate guidelines. Because a 17-year-old or 18-year-old elite level, or maybe a professional dancer, must have some different needs and requirements than an 11, 12, or 13-year-old developing dancer. Tennis and dance medicine both have the same type of issues to work through, is a culture which has been the same culture for many years, which we have to try to modify. I don't want to say disrupt, but really modify, just to improve the health of the sport. I think the field of dance medicine science is in many ways like our field of tennis medicine and science. And that must start, I believe, with having proper evidence that engages the people that it affects the most. So you must incorporate, for us in the tennis world, the coaches and the players, the academies where they're training, and get feedback on how they view the work and the research and the science will help their tennis players. Similarly, for dance, I would imagine you have many recipients of potential benefit from this, aside from the value of knowing how to treat the injury, but how do you effectively enhance the performance of a dancer in a healthy way? I am fascinated by how a dancer can make things that are so incredibly difficult seem so incredibly easy. And it's a really unique expression that's almost the opposite in sport. In sport, we like to show how hard it is to make something look so hard. And so the performance is really only the end result of an incredible amount of preparation. And it's almost the opposite in sport, where and the training plays a big role, but not as nearly big a role as it is in performance. And minor deficiencies are a bigger deal actually in dance than I would say even in traditional sport. Some of the things I tried to leave in this keynote presentation to this audience was a few dance lessons, if you will, from sport, and those are really trying to pay attention to the needs of the athlete first, and producing information that is helpful for the athlete before other data or experiences gets misinterpreted where it might affect it negatively. So if you can produce healthy performance data and then how it affects people's quality of life in a positive way potentially, or how dance can be used to affect other non-traditional methods, for example, Parkinson's disease or balance, or I think there's a lot of different ways to promote dance as a healthy activity. And if you can do that, I think you're looking at a much broader audience, and when you get a broader audience, you get broader participation.